Hi everyone, I'm Irene Khan, a girl mom on a mission to create a much needed space and empower our girls with the tools we need to navigate life with autonomy and intention. So I'm 34 years old now, but I grew up without any female role models. I don't have any sisters, my mother wasn't very mentally or emotionally present, and I didn't even have my cousins in my life until college. So navigating life as a girl and as a young woman was incredibly challenging, it was very confusing, but God really heard my loneliness and my grief, and He answered in the most unexpected way. He made me a girl mom, and He blessed me with such a large online community of women that I can learn from as well as share with. And it was really that sharing of this journey, trying to conceive this baby and learning about my reproductive health, that really sparked this entire conversation. So today we'll be talking about fertility, and this is episode 2 of a 5-part series on sex and fertility I've put together with an organization I'm completely obsessed with, HEART. So let me introduce you to their advocacy and West Coast programs manager, Seher Pirzada. I'm just so excited to put together this whole series with you. You've been the best co-host, and yeah.
This has been so much fun for me. So thank you so much, Irene, for inviting me to do this with you and inviting and thinking of HEART. So as Irene said, my name is Seher Pirzada. I use she, her pronouns, and I'm representing HEART today. HEART is a reproductive justice organization, and we work with Muslims across the nation to ensure that they have the resources, language, and choice to nurture sexual health and confront sexual violence.
So I talked a lot about my own experience learning about my fertility and my reproductive health as just a regular layman's person. And I feel like these things didn't even cross my mind when they should have at least 10 to 15 years ago. I mean, I've been married for almost 10 years now, and I didn't truly understand how to make a baby outside of like the very obvious sex, duh, but there's so much more than just that. And my TTC video really resonated with a lot of my audience. And it worried me a little bit because as a cross section, my audience really is generally a reflection of me. Similar age demographic, similar stage of life, starting or expanding our families. And so to really think about how many of us are scrambling to understand things and understand our bodies before it's too late is alarming. And, you know, it's not as early or as cut and dry as our community makes it seem, but the reality is that there is a biological clock. And I asked my audience to send in their questions on fertility, and almost all of the submissions were highly specific about infertility factors they or their partner are dealing with. And it was just a lot of problems in the now. It was very reactive and not proactive. And it's worrying. While I wish we could answer them one by one, I'd really love to just make this a broader dialogue today about what we can teach our young women, our teenagers, our Gen Zers, even us millennials. What can we do to take control of our fertility? What kind of preventative measures can we take as more of us are pursuing higher education, building careers, and just have personal goals that take time? Women are having babies way later in life than ever before. And I'd also just love to bust some myths surrounding fertility. I mean, culturally, we've heard all the crazy old wives' tales, we've heard the superstitions, and it's just, let's get to it.
Yeah, so to help us with that conversation, we're so excited to welcome our guest for this episode, Dr. Roohi Jeelani. So Dr. Roohi, Dr. Roohi Jeelani is an MD OB-GYN with a subspecialty training in reproductive endocrinology and infertility. With extensive research in oncofertility and fertility preservation, she is the Director of Research and Education at Bios Fertility Institute in Chicago. And using her fertility journey and social media platforms, she helps to educate and empower. She's also super accessible with her Instagram account, where she frequently does Q&As and is also just super down to chat with anyone about their specific situations. So for this episode, we're going to actually zoom out a little bit and focus more on understanding fertility as a whole. And so with that, Dr. Roohi, welcome to the show. And could you please just break down for us what fertility is? When we say fertility, what do we actually mean?
Thank you guys for having me, and I'm so excited to talk about a topic that's very near and dear to me. So fertility is a big topic. So if you're looking, general definition is ability to conceive and have a baby. So that's your natural fertility. And sometimes we kind of narrow, pigeonhole it and say, well, it's the ability to get pregnant. Not necessarily. It's the ability to get pregnant, carry, and then deliver. So that's fertility for a female, and for a male, it's the ability to make sperm and have sperm to then impregnate or fertilize an egg.
I love that you mentioned both male and female because one of the myths that we're really trying to bust around fertility is that it's always in the woman's control or it's always on the woman. Like, what would you say to that?
For sure not. If you look at breakdown of infertility, it's a third female, and one third both. Although age may not impact male fertility as quick as females, it's definitely a problem for both.
That's really interesting. And I think, oftentimes when we think about fertility, this is something I'm thinking we have to start talking about later in life. But we just had our sex ed episode with Angelica, also known as the Village Auntie, and she was like, actually, you kind of need to know about your body from a very early on in your life. And when we're thinking about taking control of our fertility, like we don't know what's going to happen in the future. So when should we start to actually have these conversations and look into understanding fertility as it relates to wanting to have children someday?
So I think that's early intervention. Reproductive health is essential. And think about, I mean, I can definitely speak for myself. When you have health ed class, what are you like in sixth grade, right? Learning about your reproductive cycle, what that means. I was definitely opted out. And I was like, no, 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 we're not learning about
Oh, wow.
sex. Yeah, but it's important because that's when you really learn about your cycle. Not that you're trying to have kids, but it's also understanding what's normal, what's abnormal, what should you look for. Kind of like Irene said, until it's trying to have a baby, you don't know what you're supposed to be doing, like what's normal, what's abnormal, when should you intervene. So I think not necessarily sex education, but learning about your cycle, your body, female health, early intervention when it happens. When you're hit puberty around sixth grade, you have no clue all these changes happening to you. You just kind of follow suit. You're ashamed because you're bred to think, you shouldn't talk about it, or you shouldn't be open about it. So you just, hide it away. I remember still like wanting to shave my legs, but I'm like, oh, I probably shouldn't because my mom's going to punish me. Let me hide this. But that's when you really should learn about female health. Now, trying to have a baby kind of plays into that because if you understand and have a good foundation about your reproductive cycle and what it should be, then when you're ready to have a child, whenever that may be, you'll understand your cycle and timing and what that means.
Speaking of being like opted out by our parents, even outside of sex ed, like culturally, we're just denied so much information and care. Like, I had a doctor's appointment in college and my mom just tagged along for it. My doctor was telling me that I really need to make my first gynae appointment just being over the age of 20. It didn't matter if I was sexually active or not. And my mom jumped in like immediately and she was like, no, no, no. The girls in our culture, they don't mix with the boys. Like, she doesn't need that. And then so I never went. And I don't think I first saw a gynecologist until I was maybe 27 or 28, like already married for a year or two. How do we kind of dispel that in the older generation or just in our community of this isn't about like your girls having sex, this is about healthcare?
I think exactly what we're doing. I think platform like yours and heart organizations and educating really like even now when I share what I'm like my journey and what an abnormal cycle is and why is that important, like words like miscarriage and sex and fertility don't necessarily resonate with the older generation, but things like cancer, you throw out cancer out there, you freak them out. So like telling my mom, like, hey, I know fertility may not be important because you're bred to think you have sex and you get pregnant, but look, females with PCOS who don't get a cycle, that is cancer. You're helping cancer progress and develop, and you're putting your daughters, your granddaughters at risk of cancer. Like this is essential. So it's not just for fertility, but overall health, like endometriosis. It's painful. Why do you want somebody to suffer and then get addicted and go, like for my mom, like pain, kidney failure. Hello, kidney failure. You don't need that with like constant Motrin and, analgesic. So I think talking in their language, communicating to them what they seek as important is really good, but also using organizations and webinars and educating and showing that you love your kids. You don't want them to suffer.
That's really interesting. I never really thought of it that way of like really getting on their level and speaking their language. And even just from a patient's perspective, what I really love about your page is that you share your journey with infertility as well as your professional journey. And so we really get to see both perspectives of you as a patient as well as a provider. And I feel like that makes you very relatable to your audience as well as your patients of I can understand a little bit of what she's going through and she understands what I'm going through when I'm sitting in this chair. And I just really, really love that.
they trust your opinion because you've been through it yourself. And that leads me to kind of like a curiosity around when people are looking for a provider to help them through this journey, what should they look for with regards to that trust building and expertise?
I think that's really important. So I think empathy, right? Like really knowing where that person's coming from. So I think one of my biggest things I learned being a patient is whenever somebody would say, oh, you need IVF or you need to do this, it was more like a medical. And even though, yes, the textbook and yes, my labs and everything said that, I don't think how you present a treatment plan to a patient, it should be like that because they're not a piece of paper, they're not labs, they're humans, right? So what I always try to tell my patients and what I tell my patients to look for in a provider is you don't have to be with me and you don't necessarily have to pick me. There's lots of fertility doctors, but you want to know that somebody, whoever's you pick and whoever you're going to team up with is your partner and helping you build your family, that they understand where you're coming from and what's important to you. No one literally sat me down and said, this is why you need IVF. I've got, oh, your insurance covers it. I got you failed 3 IUIs. You need to go to IVF. I got you're miscarrying. It could be genetic. You need to do IVF. I get that. That's textbook, but no one really looked at it from what's your ideal? What's important to you? Why are you doing IUIs? And let me help you. So I think as a provider, now I do that for my patients because I never want somebody to feel that way. So I always tell my patients, no matter who you choose, make sure they understand where you're coming from because everyone's family looks different. What's perfect for me and what's important to me may not be important to the person next to me. So I think as a doctor, that being a patient really helped me practice like that. But I think all doctors are patients in some realm or another, not necessarily fertility, and no one likes to be told what to do, right? So helping teach and educating your patient really helps you get a really good relationship and bond. And that's what you want. You want a provider who teaches you and tells you why they recommend what they recommend, but also understands where you're coming from.
That just reminds me so much of like in our work at Heart when we're providing advocacy to survivors of like centering who they are and what they want. So it's really about providing someone with that sense of power and control back to make informed decisions about their life. And when we're thinking about, fertility struggles, it is one of those feelings of helplessness and hopelessness where you feel like you're not in control anymore and that power has been taken from you. So being able to provide that kind of care and information where then someone can actually make those decisions for themselves is about centering them in that conversation because they're the one that is impacted. Yeah, and I just really appreciate the way that you approach your work and how you're creating these spaces where we can also have these conversations because I know also for some folks to be able to process, like they also don't want to feel shame associated with what they're experiencing. So just like talking about it is really powerful and helpful. And
So
I
much
just,
more than just bedside manner. Like hearing you talk about it now, like it's so much more than just that. And it was really nice.
Thank you.
I think, Irene, you starting this whole series is a perfect example of like how to break stigma, right? So it's something we can talk about in the open. There shouldn't be shame associated with it, and we should also still center the people who are experiencing it. And yeah, I mean, Dr. Roohi would just love to hear about your personal journey in terms of stigma breaking, and how you found empowerment or found power in having these conversations with community.
Yeah. So my journey with infertility started when I knew I would need help. So very early on, I was introduced to the field of reproductive endocrine because I got a period and then I never got a period. And I was shuffled from doctor to doctor. There, no one really knew. So it's like Irene said, you go to a family doctor and a GP and they're like, oh, it's, you're skinny. My mom was like on a mission. She goes, well, I know she eats. And then somebody's like, oh, I think she's anorexic. So like every day my mom would feed me a croissant sandwich from Burger King on our way and she'd give me a Dr.
Oh my
Pepper.
gosh.
Yeah, every day and every morning it was like assignment. Then she'd pack me like big Snickers bar and then another Coke for lunch with a bag of chips. And I was like, what's going on? And still no period. So finally she took me to a fertility doctor or reproductive endocrine. So endocrinology is the first part of fertility that we learn, like understanding the hormonal pathway. And there's this really cute little Indian lady. And younger at that time, long time ago. And when walking into that office, it was so different than your family practice doctor. There's no longer like pictures of your hearts and your lungs, but there was pictures of private parts, as our community would call it. So I was like, oh my God, where did my mom take me? So I looked at her and I was like, before, because she's like undressed and I'm sitting there really uncomfortable. She walks in and I was like, what do you do? And she's like, oh, I help people have babies, but that's not why you're here. You're going to need my help later, but not now. And I was like, okay. And then she diagnosed with PCOS. So like in my head, I always knew I would need fertility help.
I mean, for me, hearing you talk about how your mom still took you to a fertility specialist is really powerful. Like, to have that foresight and to make the effort and make it a priority that like this is something she wants to prioritize for your health is just phenomenal. I know we get, like at Heart, we get a lot of young folks who come to us and they're like, look, like I am having a lot of pain with my periods, or like my doctor has directly told me like I should start like hormonal birth control, and my parents don't want me to. And my parents think that if I go on birth control, that I'm just gonna start having sex, right? And so this like, like again, that whole thing about
birth control.
it's so stressful because it's like it's literally a health condition that they're trying to get addressed, and there's no room for conversation because they feel like they also don't have a say in their healthcare. And I know, Irene, you shared a really powerful story, if you want to talk about it, about how some of your family members have taken control of their fertility and their family's responses.
So my younger cousin, she's in her mid to late 20s and she's in no rush to get married, but of course her parents are like so up her butt about it, saying you're getting old, and whatever you argue with, they always come back to, well, how are you going to have babies? You can't have babies after 30, which we all know is false. But she told them like, no, I'm actually planning on freezing my eggs. And of course they didn't like that answer either, but I was really proud of her to have that kind of foresight to really take control of her fertility and her life and plan for the future without rushing into something now or settling. And so many women do settle in life because they feel like they're on a time clock. I don't know, it's so important for women to realize that they have options, because like last year, with the craziness of 2020, my husband and I were planning on starting to try for our second child at the beginning of the year. And I needed to have 2 eye surgeries last year. And after my first one, there were all these complications, and it was like urgent that I needed to get this corrected. And I wasn't able to drive. I was bumping into things. I got double vision. It was just such a problem. But that's when COVID was like out of control and everything shut down in LA, including doctor's offices. So I couldn't even see my ophthalmologist. Like no one could even see me. And I was just in this limbo of what should I do? Like, should I live like this for, 2 years and move forward with family planning? Or should I wait this out? But then I'm just getting older. I was turning 34 last year, and I was just in this state of limbo, and it almost felt like a situational infertility almost, because I couldn't move forward, but I didn't know what to do. And I was like, if I knew I was going to be in this situation this year, I would have frozen my eggs last year. Then I wouldn't be in this like state of paranoia of how long is this going to get drawn out for. And it's just, I don't know. It's just crazy, but it's so great that women have these options now. And I just feel like we need to just know more about it, know more about egg freezing and more preventative measures and things like that. So I don't know. I would love if you could break down what egg freezing entails, or what other options women have if, we haven't found the right partner, or it's just not the right time to have children, or who knows what. There's so many different reasons why we would wait.
Yeah. It's the biggest thing with egg freezing is most people think they extrapolate, right? Because everything's kind of data, everything that we hear is about IVF, like when you're trying to have a baby and you don't have a baby. So all these myths and things come over, like, oh, if I freeze my eggs, I can't travel, or I can't work out, or I have to do X, Y, and Z. And they start taking all these things away that you actually think about when you're actually trying to have a baby. But with egg freezing, it's actually really quick and easy. So you do your consultation, you do an evaluation, which is an ultrasound and blood work. And then when you're ready to freeze your eggs, because it's independent of your cycle, you don't have to follow your cycle. Your eggs are always there. So females are actually born with all of their eggs, and they're created when your mom is 5 months pregnant with you. So technically, your mom carried her grandkids, which is insanity. Like every time I think about that, I was like, that's so crazy. Like it's the human body is just phenomenal. But you can freeze your eggs. It's 10 to 14 days of injections, egg retrieval, and then you're done.
Is there a certain point in time where it's too late to freeze your eggs?
So not necessarily too late to freeze your eggs, but you may need more than one cycle. So the younger you are, the healthier you are. So peak fertility is actually at age 23. And after age 23, it steadily starts to decline. So from 23 to 28, it's pretty level. Then after 28 to 32, it takes a little bit of a dip. After 30 to 35, it goes a little steeper. 35 and on, it goes steeper. So if you look, women who freeze their eggs, most women freeze their eggs in their 30s, but the women who freeze their eggs after age 35 are more inclined to using them because that means they're not in a place where they would want to get pregnant, whether they're not married or have a partner, whatever that may be. But by the time they get to that stage, it's about 2 to 3 years from when they froze their eggs. And then you cross over to your 40s. Not to say you can't freeze your eggs in your 40s, you definitely can, but just know your abnormality rate, meaning how many of those eggs are actually going to yield a healthy live birth, is lower. So you may want to increase your odds by freezing a lot more eggs.
Somebody did ask, if I freeze my eggs in my 20s, does that mean I have to go via IVF later? Or could I, does it rule you out? Like, are you going to use up all your eggs? Essentially, I think that's what she was asking.
Not at all. So as females, every month, whether or not we're trying, whether or not we're on birth control, are out of the 200,000. So we're born with 3 million, puberty hit, it goes down to 200,000. Then every month our body recruits 90 to 100 eggs. Out of that, 6 to 12 activate, and it's either you use it or you lose it. So that's what egg freezing is, taking those 6 to 12 out and freezing it. So if I didn't take them, you would have gotten rid of them anyways.
That's super helpful to know. I know that, we've talked a bit about IVF in this. Could you actually break down for us what IVF is and what it entails?
So IVF is in vitro fertilization, basically Latin for in-glass fertilization. So you do the first part, like egg freezing. You take injections for 10 to 14 days, egg retrieval. The difference is in egg freezing, I freeze your eggs that day and you're done. With IVF, that day your husband or your partner gives me the sperm. I take your eggs and I force them together. So each egg with one sperm create an embryo. Not all eggs will actually accept the sperm. So the next day, typically we call them and let them know, okay, out of X number of eggs, this many were good. Out of that, we fertilize those good ones, but only typically 70% accept the sperm. So then that's in vitro fertilization, meaning in-glass fertilization. And then we grow them in a special media that's very similar to your body. So it's rich in amino acids and sugars. And then it separates in that little dish into a baby and placenta. That's called a blastocyst.
Wow.
It's insane to watch it go from this little cluster of cells, 2 cells, one you and your husband, to then a full embryo, baby and placenta. And at that stage, we can actually genetically test the embryo to determine chromosomally, like boy, girl, Down syndrome, trisomy, all of that, and then either freeze them or put back inside of you. So for me, this time around, I did fertility preservation. So I knew I wanted a kid. I wasn't ready. We had 2 through fertility treatment. It was really took a lot to kind of even go back and say, yes, my ideal was a 3. How do I get to my 3? My husband wasn't ready to kind of go down that path again. So I said, okay, well, I'm going to freeze my embryos. And then when we're ready to try, then I don't have to really worry about age and, what that does for my chromosomes, Down syndrome, and all of that stuff.
Wow, that's so interesting. I never even thought that, in the dish, is the baby and the placenta. I thought it would just be like a clump, and then you
No,
transfer
isn't
that.
it
Like,
crazy?
it's
Yeah.
crazy.
If you look at like a time lapse of the embryo, you can see it goes 2 cell, 4 cell, 6 cell, 8 cell, and then it like smushes down into what we call it a morula. So then it becomes 1 cell mass, and then the next day it separates, like blossoms into a baby and a placenta.
That is so
Gosh.
powerful. So
Yeah.
you mentioned about the genetic, like you basically can look at the genetic material and identify if there are any abnormalities and what the gender is. And we chatted about this during our pre-interview, but could you like just share little
We were like
tidbits?
mind blown.
I know, just about like what you can learn about when it comes to a person, like a baby's genes or embryo's genes, and what people tend to like. There was a whole conversation we had about gender selection, and I'm just curious to see what parents who are usually going through this process, what are they looking for on average?
Most people tend not to gender select. So I actually just published a paper on the ethical considerations of gender selection. So when you look at it, most couples just say, okay, best embryo. I'll be very honest and candid. I don't think it's wrong to gender select. I'm definitely gender selecting and trying to gender balance my family because I think sisters are important. So I have a daughter and a son, and I think having two girls is really powerful. I was really close to my sister. I'm really close to my mom. And I think females need that support. And you never know what life will bring and, how things progress outside. And sometimes you're not as comfortable sharing with your parents as you are maybe with a sibling. So, yeah, so I'm definitely gender balancing. But in addition to looking for that, we actually had a scare with my daughter that she came back as Down syndrome, like her pre-screening, my 12-week appointment. And it was probably the scariest 3 weeks of my life because I was really ethically and religiously so torn about what am I going to do. It was a lot on my plate, my husband's plate, and by the time we would find out, I'd be 6 months because then you'd have to do your amnio and MFM. It was just so much. That idea and that concept, being an older parent, like we spoke about, when you go to graduate training or whenever you career focus, it takes away from how quickly or how early you may start your family. And I know some people do it simultaneously. I just didn't have that. So by the time I was in my family planning, I was well into my 30s. So to have that possibility and that probability of that happening again was just not an option for us. So I did do IVF. I selected healthy embryos. I do have my embryos that are not, chromosomally normal. They're still there, but those are not the ones I would gravitate towards or transfer. So that was my reason. But you can also test for if you have a family history of cancer, like leukemia, which is linked. You can check for that. Huntington's, breast cancer, ovarian cancer, and I feel like you can gene eliminate that. So you can say, hey, we have a BRCA gene. I don't want my daughter to go through what I'm going through or my mom went through. So you can eliminate that.
That's so interesting. Like, science has come so far. It's incredible. But I think on the flip side, I think it'd be cool to bust some myths on what isn't in control, because people have this like idea that you can make designer babies and this and that. Like, my daughter had gray eyes as an infant, which so many babies do,
Yeah.
and they're brown now as so many babies change. But during that time, I would get the worst trolls of made a designer baby. Like, how did two brown parents have a baby with gray eyes? And it's like, first of all, so many babies have gray eyes and they change, right? And like, that's not even a thing. Like, you can't even pick eye color like that, right? Like, maybe I'm wrong.
Eye color is multifactorial. It's not like one gene. You can do gene selection, and even then, like you said, people troll. When I said I'm gonna pick the gender of my baby, oh my god, it went like I had like 1,000 DMs. Like, what's next? What else are you gonna do? How do you feel playing God? It's a whole different, I think, conversation. But yes, you cannot pick the eye color or the hair color or how tall your baby is, but you can choose to have a healthy baby. As a parent, you never want a sick child. To see your child suffering is horrible. So giving your kid like who has cystic fibrosis a lung transplant constantly in the hospital with pneumonias or thalassemia, like bone marrow transfusions and blood transfusions, like what parent wants to see a child go through that?
Right.
I think it's such a personal choice too. Like for some
Yeah.
folks, it's really just about folks' willpower. They're also like, it's an issue of, do you have resources to provide for
Yeah.
the child? Like, I know that in Heart, we also often get approached around legislation regarding like terminations and abortions, and just also like how they use that like stereotypes that come up of like, oh, well, like Asian communities don't want girls, and so we should just eliminate the option for any abortion so that we can, squash that as a possibility. And it's just actually a way for people to tell other people what they can and cannot do with their bodies and what they can and cannot do with their families. And I think that is also like another huge conversation that folks in Muslim communities like need to be having about how like, okay, like you pressure people so much to have children, but what are you doing to support them with that process? And also, like, what are you doing to also like support folks who don't want children? Because that's also something that is becoming more and more common that I'm noticing of like folks are just not in a position of their lives where they can have children. And it shouldn't be anyone's business. And I'm going to put a plug for my shirt, which is basically talking about exactly that. Like, stop asking women when they're going to have children, because there are multiple reasons for why, and also because it's none of your business.
Love
But
that.
yeah, like I myself suffered from vaginismus for many years, and I still have vaginismus. And it took us like a very long time to conceive our first child because of that. And we were so, so excited about our first child. And we went through all of the genetic testing, and the results came back that our baby had trisomy 18. And it was a very, very, I mean, like you said, that those few weeks in between where you're waiting for those test results to come back, like it feels like a lifetime. And it really is the hardest thing. Like, you cannot focus on anything and you're just waiting for that call to come in. And no matter how much dua that you do, you also can't change the results of what is there, right? It's Allah's will. And I remember getting the call and just, completely shattering, because it's just such a reminder of you are not in control. And we made the very difficult decision to terminate that pregnancy. And there's like a huge stigma that I still face with regards to sharing this story. And this is the first time I'm sharing it, but I feel like it's important to talk about how when people think of abortion and when they think of termination, they often only think of unwanted pregnancies, and they don't think of the struggles of families who are actually trying to conceive and have children, and the terminations that come from those experiences, and the grief and the loss, but also the shame associated with talking about it. And it's a different kind of shame because it holds some sort of religious weight. It also holds some sort of social weight. And there's a lot of, I will say, there's a grieving process that still comes with it that goes unnoticed. And I, just want to thank you for like opening up these conversations where people can remove that sense of shame, but also try to find community to be able to grieve with other folks. I think even miscarriage is something that folks are talking more and more about. Abortion, we have a long way to go, but I'm hoping that by sharing today, like folks can also realize that it's not.
Thank you for sharing that.
Yeah, that's so powerful. There's so many spectrums of that child, that baby, that suffering, like it's a lot. So thank you for sharing that.
And I think your point about also how religion comes into factor is important. Like, I remember through HEART, alhamdulillah, I had access to talk to scholars that I trust about this. Like, what is the permissibility, and like how does this align with like how I think about rahma, right? Like compassion towards myself, compassion towards the child that I'm holding in my body, and just knowing that, we talk to a genetic specialist, we talk to our OB-GYNs, obviously, but we also talk to religious scholars, and we talk to folks who sit at that intersection of like fiqh and medical knowledge. And they were like, yeah, like according to science, Islamically, this is allowed. And, if the opportunity is there, it is your choice, right? And that also helped me like breathe, because it was important for me to have that kind of conversation in that space, and to be affirmed that like Islam is not black and white about a lot of these things. There's so much nuance there. And so if there's nuance in the faith itself, like why are other folks in the community then also placing judgment on that?
We have a long way to go with things like that, for sure.
And I think talking, like you said, knowing, I think people just blanket, like birth control. Like you say, I'm on birth control. They're like, oh, she's having sex. It's like a blanket, these um, extrapolating all of this stuff into that. And even when I was doing IVF, people felt the need, oh, why are you doing IVF? Are you and your husband having trouble? We may be, but like it's just things that people need to educate themselves about.
Yeah, and establish boundaries too. Like, everyone
Yeah.
deserves a safe space to share what they want, but they also deserve that privacy to not have people be invasive about it. It all comes down to consent, right? Like, whatever you feel you want to share and what you feel free to share. But yeah.
Right. I know that was a lot, but I think there's also just a lot of myths that exist out there, right? About fertility, about miscarriages, about how to get pregnant, how not to get pregnant. And those myths like lead to like us having psychological blocks when we're trying to actually make decisions about our lives.
Yeah,
I mean,
and
the
those
number
myths
of things, yeah.
conveniently affect women, I feel like, more than anything.
It's
Like,
like, oh,
society.
drink this and it'll, you won't have that problem, or eat that. And like, I know, Irene, you found some really even funny myths that I want to hear what they are, because I have only heard like maybe one or two.
Oh my god, what were people even submitting? It was like, "Oh, if you eat cold things, then you can't have babies." Like, it was, like, so ridiculous. It's like, who came up with these things? I don't even know. And, but then, like, some things will get, like, really serious. Like, I was in Jordan last year, and we're at our, like, hotel, and this guy was helping us, guy that worked there, and he had a daughter, like, the same age as our daughter, so he was, like, bonding with us over that. He was showing us pictures, and then he starts bragging about how he got a new wife because his wife couldn't give him boys, and he was, like, laughing about it, and I was like, "I I can't deal with this right now." I literally just walked away because it's like, first of all, that was you, and second of all, how ridiculous are you? Like, I couldn't even have that conversation, but
I feel so
I don't
bad
know.
for the wives. Um, so do you want to share, like so you said, don't eat cold foods when trying to conceive. I know there's like, I mean, I'm curious though, because some of the stuff I'm like, if you're also in that desperate situation where you're actually trying to conceive, like, you'll, I was ready to try anything. So would love to hear from a specialist as to which ones are myths and
We
which
heard it
ones
like
hold
that,
some
like,
truth.
myth and fact.
Most of these are myths, but sometimes there's like, if you look at it, I look at these myths and I'm like, oh my god, there's like some rationale behind it. So not necessarily scientific rationale, but it kind of plays. So like healthy, right? They're like, oh, drink a healthy milk, it's warm. It's not really warm, but healthy is anti-inflammatory. To what level and what degree? I don't know, but it does play a role in inflammation. One of the pathophysiologies, meaning when you look at infertility like endometriosis, PCOS, they're inflammatory. Inflammation hurts your eggs, hurts the sperm. You have lower fertility. So take an anti-inflammatory like Haldie. Is it going to get
Mm,
you pregnant?
so there's some truth
Probably,
to the
yeah,
old wives'
probably
tale.
not. But it comes from some something
Something.
that somebody said. Yeah, they were onto something. So like eating cold foods that makes your body hostile for pregnancy. So
Oh,
warmth, if you think about it like that theory, it's warmth helps. It's a thing with ovulation, right? When you're warm, you're ovulating, like your basal body temperature goes up. So you want to keep it warm because the theory, like you incubate an egg, if you go in our OR, it's so hot in there because eggs and sperm like warmth. So is it true that if you eat cold foods that you're not going to get pregnant? Probably not, but that's
I
where
was
they're
gonna say,
getting
this part's gonna get circulated in, like, auntie WhatsApps, like,
it.
"See,
Yeah.
we were right."
I mean, like we knew what we're talking about. So definitely not. I think they like how people like exaggerate the truth? That's exactly what's happening with these myths. Like
That's
when
funny, but
you
it's interesting
yeah,
that they're based in something, right?
yeah,
Like,
yeah.
a big myth that we got is, if you're on birth control for a long time, then you're gonna have a hard time getting pregnant. That was a big one that we heard, and that's something I always heard from my mom too, and so I've never been on birth control. Probably for that reason, because there's always that little voice in the back of your head of like, "Oh, this could be true," you know?
So 100% not true. Quite the opposite. When you're on birth control, depending on what type of pill or form of birth control you're on, you're actually the most fertile 3 months from within stopping that pill, those 3 months, because your body's like in a panic state. So I tease and I tell my patients that birth control is like a mistress. So your brain is you, and your ovary is your husband, and they're communicating. So your brain tells the ovary, hey, make an egg. Then your ovary responds and it makes an egg. Birth control goes in there and it distracts the ovary, so it quiets it down like a mistress, and then your brain doesn't work and it doesn't ovulate. So as soon as you take that away, that third party, then your brain and ovary start talking again, and then they're fertile. So immediately, the minute you take that birth control away, your brain goes, oh my God, where's this person? Like, what's going on? Where's my satisfaction? So it starts working really hard. And that's why you're the most fertile in the first 3 months of taking birth control. Now, of course, that's the pill form, the hormonal. There's a lot of forms of birth control. So there's like an IUD, which can affect your lining. And yes, you may take a little bit longer to build your lining up and get pregnant, but nothing permanent.
Best analogy I've ever heard. And I've been doing sex ed education for like 5 years. That was so good.
It's so great to put things into layman's, right? Like, it's a mistress, essentially. Oh my gosh, that's hysterical. So another one was, and I actually saw you answer this on your stories. I think someone asked you as well, but it's harder to get pregnant if you've taken Plan B in the past.
So definitely not true. Plan B is levonorgestrel. So it's a progesterone. It's high doses of progesterone. So what it does is it impacts implantation. So it makes your lining not good for implantation. So even if fertilization happens, it prevents the implantation part of it. It disrupts that part. And it's just for that cycle. So anything that you're doing, it's only limited in that cycle. So once you stop taking it, so Plan B you take for that day, you're done. You inhibit the progesterone receptor, so you can't implant. And it also, high progesterone makes your cervical mucus really thick, so it makes the sperm less motile. So that's why there's like a window opportunity that you can take it, and it does not impact your future fertility.
What about the myth around that infertility is really rare and it only impacts like a very small percentage of our population? Like, what are the actual statistics around it?
So if you're looking at general population, so 1 in 8 couples will have infertility.
Wow.
Yeah,
if you're looking at like people who go to postgraduate training, or I would say even over 35, it's 1 in 4 couples will have infertility.
And then what are, like, when we're thinking about miscarriages, how does that come into play for fertility or infertility?
So one of the first signs of lower egg quality or infertility is recurrent pregnancy loss. So first you have recurrent pregnancy loss, and then you have infertility, and then you become diminished ovarian reserve, like no egg. So recurrent pregnancy loss can be due to 3 main factors: chromosomes, meaning you're so low on your quality that the egg and sperm are not splitting right, and you're having chromosomal issues, so it's not implanting, or if it implants, you're miscarrying. And then number 2 is structure. So for some reason, the egg and the sperm are meeting, but the structure where the cavity sits, it's not perfect. It's triangle, so it's implanting, but then miscarrying. And third is autoimmune or endocrine, like your thyroid, your prolactin, your vitamin D. So it's not good for pregnancy. So your body's attacking the baby.
So aside from that third factor that you mentioned, would you say miscarriages generally are because of an issue with the embryo? Is it embryo at that
Yeah,
stage?
yeah, yep.
Yeah,
That's
like it's
exactly
not
what I'm saying.
something you did, right?
Yep.
And that's what a lot of women will blame themselves, like, "Oh, maybe I was being too active, or I was doing too much of this or that, or I ate this."
I love that point. Yes. When you have a miscarriage, you like try to trace your steps back. Maybe I was dehydrated. Maybe I was too stressed. You can't cause a miscarriage. It's really hard to cause an actual miscarriage. Your body's really protective. There's like 3 thick layers of the uterus that hold this baby in. So it's mostly chromosome.
That's such an important point, because not only do women blame themselves, but they'll have mother-in-laws or husbands or family, like, blaming them too, and it makes that loss so much harder to grieve, right?
There's also a lot of trauma that folks carry for so long afterwards of like will I ever get to that point of having a healthy baby in my arms? And I know that's also like for pregnancy after loss, right? So even if you've gone through the reoccurring miscarriages or even one miscarriage, and now you're in a pregnancy that is like medically seen as viable, I feel like the trauma that you carry until that like finishing point of giving birth and having that baby in your arms is also something like folks don't think about. Like it's often like minimized. Like I know so many couples who the pregnant person is like really stressed about something bad might happen until the end. And folks are like, no, but you've made it to the second trimester. Like, don't worry. And I know like the frequency is less for, later term miscarriages or stillbirths, but that's still a factor. And I don't know if you have like statistics that you can share around that or how that plays into factor for infertility.
Yeah, so that's why we keep, as fertility doctors, we keep our patients up until typically the end of placentation. So usually chromosomal abnormalities will cause you to miscarry between week 5 and week 8. There's 3 major chromosomes that are compatible that will make it past that: trisomy 21, 18, and 16, or 13, pataus. Before that, all will miscarry. So we'll say, okay, let's get you till at least 9 weeks, and then you go to your OB. The risk of miscarriage after week 8 goes down to less than 10%. After week 12 goes down to less than 5%. But that unknown fear of like a stillborn, cord accident, abruption, high blood pressure, that will essentially never go away. Every pregnancy is different. So you can have a healthy live birth, but in a subsequent pregnancy, you can have something like that. Those are unpredictable factors. If there's something causing it, like say you had a stillbirth because of an abruption for high blood pressure, then your subsequent pregnancy we talk about, oh, you're going to be on a baby aspirin, you're going to get more frequent monitoring. So those things are preventable, but not necessarily you're at a higher likelihood, but there's not a percentage that it's going to happen.
And speaking of like subsequent pregnancies, another myth is you can't be infertile if you've already had a biological child.
It's actually the biggest myth. So we see more secondary infertility than primary, because most people, by the time they want to continue their family building, are now officially in like their mid 30s or late 30s. Because now, if you look at the average age of conception in the US, it's in their late 20s. So by the time we start thinking about baby number 2 or 3, secondary infertilities, that's when our biological clock really starts to decline.
So it's secondary infertility generally because of age?
Usually, but there a lot can happen between like a diminished reserve or a complicated pregnancy and delivery that can cause scarring, which can now make the uterus not so responsive to implantation.
That's
super
so interesting. I'm wondering if you've heard, as a doctor, if you've heard of any myths that you want to take this time to dispel for folks watching.
Or even patients that like diagnose themselves, right? Like what's the
Yeah,
most ridiculous thing that a patient has said when they came in? Like, I can't do this because of this.
I think the hardest thing for me as a doctor is when I want my patients to be really educated and informed, but from the right sources. I think when patients come with like, I'm on these supplements and I'm going to another doctor, not necessarily an MD, but I'm using progesterone on the cycle day and I should get pregnant. So like PCO patients, I see a lot of PCO patients, and I don't know if it's because I'm PCO, people gravitate towards me. And then they'll say, oh, I'm on progesterone starting cycle day 21 and I'm getting a period, and they told me that's ovulation and I'm not getting pregnant. So in my head, I'm thinking, wow, you're basically taking birth control and then you're getting a withdrawal bleed and you're not getting pregnant. But like for me to frame that and say, hey, progesterone, and when you stop it, you're getting a withdrawal bleed, not because you're ovulating. And it's like utter shock. And they stare at me like either I'm crazy or I'm calling their other doctor a liar. And I think I want my patients to be educated and empowered, but from the right sources. Or like, oh, I took maca root and my FSH is low, so I'm good now. Not necessarily. Once you get a low egg quality, even if your FSH goes down, your follicle stimulating hormone, like that brain hormone, is not working as hard, that doesn't mean all of a sudden your eggs are fixed. It's really hard to fix quality. In fact, I don't even have the cure for it. So I think knowing your right sources and knowing who to go to. And as a patient, like, I don't blame them. It's difficult, right? You're in this like open space where everyone can write something down. And I think it's hard to know as patients what's right, what's wrong, but being open to changing what you thought, I think, is important. And then myth number 2 is like having sex. Everyone's like, oh, I held my legs up there and I even slept like that. That
Oh my
definitely definitely does not help. I even got like, oh, I propped my butt up on a pillow. That does not change. Sperm is, there's millions of sperm, millions and millions and millions of sperm. It will not fall out. It will stay there.
That was a big one that a lot of women submitted, like, "Does legs up really help?" So,
Yeah.
Legs up and pillow. I've heard both of those.
Yeah.
yeah.
I'm not gonna lie. I've tried both of those too. So
You said something, I can't remember, like, verbatim what you said, but something like, "Oh, even I don't have the answer to that." What is, like, a realistic expectation for a patient when they come, not a realistic expectations, but, like, what are the limitations really? Like, what can your doctor help you with and what can they not help you with? You know what I mean? Because
Yeah.
I don't I don't know what the question is.
That's a good question. Like,
Yeah.
when do you know that you've done everything in your power? I think knowing, one, that you can switch doctors is huge. And two, essentially fertility, as advanced as we are, it's a really new field. Like the oldest IVF baby just turned 40 last year. And that was like by accident too. It was like, you should see this contraption that she was incubated and she has like a picture holding it. So it's like so fascinating how much we've progressed in such a short time, even from when I started, like in the early 2000s to now. We do things so differently from than when I first learned about it. So I think it's a learning game as much as it is for me as you. So when, what you should expect, like what can your doctor do? There's only like 5 medications that we can use. We just play around with the cycle. We have to amplify what your body gives us. We make a very educated guess based on what we think is going to happen, but it may not pan out that way. And going to another doctor and expecting a complete 360 is usually not going to happen, but you should do what you're comfortable with. Like, I switched so many doctors because I wanted to know that, hey, I've done it, but I didn't like how I was being presented the information. So if you're doing it for that, 100%, but if you're doing it because you think somebody else has that magical cure, I think that's hard. Know that it's a new field and know that we're learning your body and know that not each cycle's the same.
Here's another question. I know I'm just, like, rambling off questions now, but even though the infertility factors are generally balanced between men and women, at the end of the day, it's still the woman that has to, like, go through the treatments, right? What treatments are there for men, if any? Or is it
Yeah.
all on us?
No, believe it or not, men are more complex than females. So females, it's so simple. It goes, brain makes food, food goes to ovary, ovary responds and makes an egg. And the male, it's brain makes food, the same hormone, the FSH, which then goes to the testes, which then makes testosterone, which then makes sperm. So they're in a constant flux. It's not the same. And you can't measure and you can't say your FSH is this and your testosterone. So there's no direct communication. It's more of a zigzag. So yes, we are huge at BIOS. We look at male fertility. We actually have an in-house male fertility urologist. So anytime a patient comes to me, it's not just me. Say, okay, you will be doing this testing with me. Your partner, your husband will be doing this test with Dr. Pagani. And then we'll regroup and try to understand, because it takes 2 to make a baby. Because there's such a constant change, every 30 days they get a whole new batch. It's not as reliant as females, where I can say, okay, your FSH this is this, which is an indication of your quality. Your AMH is this, which is an indication of your quantity. Males are like, you need 2 abnormals 2 weeks apart to say, it is truly a male factor. Both times you gave me a sample, it was abnormal. Yeah. So it's a little bit more difficult to analyze. So I think we shy away from it. And then we say, well, we know what to control. We can control the eggs. And then it's simple. We take the egg and we push it in there. So males, because there's millions and millions, we don't focus on them as much. Females, we're not dealing in the millions. We're dealing in like the tens of 15s of eggs. So there's more research and more concentration on the female.
such a random thought, but I was just like, recently, like in the past, I would say like 10, 15 years, there've been a lot of Bollywood movies that address like infertility, which I've like so appreciated because I'm like, dang,
Yeah.
like it's time we talk about this. There was like Vicky Donor,
Yeah.
and then there was like one with the same guy who did one about erectile dysfunction.
Oh, wow.
I don't. It was pretty good. It was pretty good. But I just also like appreciate like this narrative shifting that's happening like in the larger community to like normalize these things and to
Yeah.
break some stigma around it.
Yeah, it's huge, especially in Bollywood now. There's so many surrogate babies and third party reproduction. And even if you look, there's actually single parents by choice. My God.
Oh, wow.
Shushmita Singh is a huge advocate for it. She's a single parent by choice. She has one baby through adoption. She has another baby through this process, like a surrogate. Like it's huge right now in
Did
Bollywood.
you say Sushmita Sen? I'm like obsessed with her. I think she's like gorgeous and so brilliant and also just like a fierce feminist advocate.
Yeah, she's a single parent by choice.
Oh, I didn't
Yeah.
know that about her. That's so
Yeah.
cool. So I guess to wrap this up, what advice would you give to young girls, girls in their 20s, like to just take control of their fertility and like plan for the future?
Don't be shy. If you know you want to have a family and it's not the time for you, don't let this like culture, stigma, not even culture, like whatever is kind of holding you down, do it. It's never too early. Younger eggs are always better. Be your own advocate.
Do you feel like there's been any shift with like insurance starting to cover these things at all, like egg freezing or IVF? I know some companies do, like Google and I don't know who else,
Yeah,
but
100%. I think so. I'm a part of an organization called Resolve, where they go to the Capitol once a year and they advocate, it's called Advocacy Day, for federal legislation to mandate coverage for all of this. Um, I live in Illinois, which is one of 9 states that covers fertility preservation, oncofertility for cancer patients. And there's like these little small companies that are now starting to go like progeny. I'll say it'll go to a company that may necessarily not cover fertility, but say, hey, do you want to offer your employee benefits to cover fertility? You know, and they're like not a big insurance, but there's somebody your employee can contract. Or go to your HR because they want women in the workforce. They want strong, empowered, educated women to stay there and say, hey, I want to freeze my eggs and I want to be with you guys. So how can I protect my fertility? What do you guys have to offer? And I've seen HR companies give a stipend of like 5,000. Here's for one cycle.
oh, I
Um,
would never even
yeah,
think like ask for that.
yeah.
That's
Most
cool.
people like negotiate it. Like if you know you're in a job long term or that's where you want to be and you're going to build your career, ask away.
My like follow up to that is in addition to the capitalist corporate world being like work longer and delay family planning is they should also support family planning when it's
Right.
happening, like if you want to have children younger but still stay in the workforce. Like I think COVID has illuminated like the struggles of that, but we need to like invest more money in like supporting working families and specifically women who are like working from home because they also have to take care of kids. Like it's my biggest gripe with capitalism. I'm like, y'all do not appreciate the
Also,
labor that goes into
support.
childcare.
You want the support if you choose to go that route, but you need the support if you don't choose to go that route too.
Yeah.
Yeah, I have a whole new appreciation for childcare. I've never had before the pandemic. I was like, well, this is a rough job. I don't think I could do it full time.
Oh my God. Ruhi, thank you so much for giving us your time today and all of your knowledge and expertise. Everything was so interesting. I swear I learned so much. And also, thank you for opening up about your own personal journey as well. You too, Sahar. Both of your stories, I'm sure they weren't easy to share, and they will help a lot of people and really be meaningful for a lot of people too. So I'm so excited that we did this. I feel like we're all going to walk away with so much more knowledge and information. And, you know, it sounds funny, but like the goal really is to have less women come see you in the future, right?
100%. I think what you said from the beginning, it's we're going to shift the conversation. So you're no longer coming for fertility treatment or infertility, but you're now coming when you're ready to implant your frozen eggs and thaw your embryos and be pregnant at the time you want it for. So just a shift in culture.
Yeah, like I think I mentioned earlier, it's just so important to be proactive rather than reactive. And that's one thing I really noticed from all the submissions, that it was all current problems in the now that women were going through. It wasn't about planning for their futures. And that's really the shift I would love to see. Me being a mom of girls, you both have daughters as well. And it'll just be so much better for the next generation, I think.
That's exactly what they need, 100%.
Thank you so much for helping us create this space. And everyone, please follow Roohi on Instagram at Roohi Jeelani MD. And you can also check out her practice at Vios Fertility. They're in the Chicago area if you guys do need to see someone or speak to someone. And yeah, I'm so excited for the rest of this series. And we will talk to you guys soon. Bye.
Bye. Thank you.